Hi, my name is Omar Bagani, and I'll be talking about PCL tears in the knee. The anatomy of the knee. First, we'll be talking about the bones that are located in the knee. First one is the femur, which is the thigh bone, patella, or the kneecap, and the tibia, also the shin bone. The ligaments are what connect bone to bone. The ligaments in the knee include anterior cruciate ligament, also known as the ACL, lateral collateral ligament, the LCL, lateral meniscus, posterior cruciate ligament, PCL, medial collateral ligament, which is also known as the MCL, and the medial meniscus. The muscles inside the knee. There is the iliotibial band, the hamstring tendon, quadriceps muscles, quadriceps tendons, patella, lateral patella, retinaculum, and patellar tendon. With the anterior muscles, flexion and lateral rotation of the hip, flexion and medial rotation of knee. The patellar tendon runs over the patella. Patella ligament is attached to the tibial tuberosity. The medial meniscus of the thigh is the vastus medialis. And for the posterior muscles, the flexor muscles allows for knee flexion, and posterior lateral of thigh is devoted to bicep femoris. Mechanism of injury refers to the manner in which a physical injury has occurred. This is used to estimate the forces involved in trauma and the potential severity for woundings, fractures, etc. So the mechanism of injury, or the MOI, for a PCL injury would be that the cause of this would be an athlete is injured when he or she falls and bent knee bears their full weight, and the knee is forcefully hyperflexed, or when the blow is delivered to the front of the tibia. There is a YouTube video that I'm not able to pull up right now because of some technical difficulties, so if you are interested in learning more about this kind of stuff, you can go to this link. Next, we'll be talking about signs and symptoms. Signs are something that the athletic trainer notices through an observation of the specific injured area, also objective. And symptoms are something that the athlete feels and has to communicate to the athletic trainer, which is subjective. Signs and symptoms of a PCL injury are very straightforward and simple. The signs are that there is a little bit of swelling and there may be bruising, and symptoms are that the athlete reports having heard a pop. Acute treatments is when a patient receives active but short-term treatment for severe injuries such as a break or tear of a bone, muscle, etc. An acute treatment for a PCL injury or tear would be a rehab program and physical therapy. A rehab program is dependent on degree of injury and type of treatment rendered, such as operative or non-operative. Non-operative is used to control the swelling, instability, and pain, and operative is used to control pain and swelling through the use of cold therapy, compression, and elevation. Crutches and a long leg brace should be used as well, and also physical therapy. Long-term treatment includes rehab and surgery. Rehab is rest, ice, compression, and elevation, which is also known as the Rice method, and it should be used for several times a day. Crutches and a long leg brace recommended for grade 3 injuries, and rehab should begin 1 to 4 weeks after surgery. Surgery will control the pain and swelling through the use of cold therapy, compression, and elevation, and patellar mobility is very important and is the goal for surgery, and the patient should be instructed in self-mobilization exercises to prevent fibrosis. Fibrosis is the thickening and scarring of connective tissue, and it should take up to 3 months to fully recover. Next, we'll be talking about the rehab program, which includes 4 stages. The first stage is stage 1, which is acute and inflammatory phase. The goal of this stage is to control inflammation and restore mobility. There are 2 types of exercises in order to achieve this goal, and that is the stretching exercises and strengthening exercises. Stretching exercises include calf stretches, hamstring stretches, and ankle mobility, and strengthening exercises include static quads, static hamstring holds, and calf raises. Stage 2 is known as the intermediate phase, and the goal of this of the stage is to increase proprioception, muscular control, and strength. And for this stage, only strengthening exercises are required, such as standing static quads, half squats with both legs, hip raises, hip exercises against resistance, step-ups, and single left calf raises. Single leg, sorry. The third stage is the strength training phase. The goal of this is to increase muscular strength and endurance to support levels. The exercises should be rather simple, and it should begin with gradually returning to running. And if athlete is progressing, speed work can be gradually introduced, and backwards and sideways running / quick change of direction should also be introduced to see how the athlete is doing with the exercise. Lastly, the stage 4 is sport-specific function phase. The goal of this is simple, is just to return athlete to play. The exercises should include sprinting, and it should be close to normal. Normal sports-specific training should be resumed, and athletes should be returned to sport in a limited capacity, meaning that the athlete should report to their chosen sport with limited time so that they can get back in the feel of the game, and so that they don't exert themselves too much. With that being said, that is the end of my presentation on PCL tears and the rehabilitation program for them and the anatomy of the knee. If you would like to see more, hit that like button. Yeah. Here's the bibliography, the sources that I used for my information, and yeah, thank you for watching.